Welcome to Doctors on Call. I'm Jenna Miller. We are well into the cold and flu season, but how do we know the difference between strep throat, the common cold, RSV, or even COVID? What is norovirus? How do viruses affect the human body? Obesity is a complex disease involving having too much body fat. Obesity isn't just a cosmetic concern, it's a medical problem that increases the risk of many other diseases and health problems. These can include heart disease, diabetes, high blood pressure, high cholesterol, liver disease, sleep apnea, and certain cancers. Are the new weight loss medications safe and effective? We'll tackle these issues and more on Doctors on Call with our guest, family physician, Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Tyrel Summers received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine, Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic wounds, gastroenterology, psychiatric care, diabetes care, and joint pain. He's been affiliated with Russell Regional Hospital since 2015. Dr. Summers is married with 8 daughters and lives on a small farm south of Russell where he enjoys caring for his many animals. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us again. We're glad to have you back. I think we said this is third time's a charm. Yeah, so thanks for bringing in the snow. Okay, let's get started. First of all, what kinds of mistakes do people make when they're getting sick?
Yeah, so I think one of the primary things people do when they're sick that they make a mistake on is not recognizing like the different kind of illnesses early on and intervening in them quickly. Like one of the best things you can do initially when having kind of an illness is determine if you need to be seen quickly or not by a provider. What I mean by that is in some cases, early intervention is really crucial and really important to maintain appropriate treatment in a fast and precise way. For example, influenza, especially influenza A and B, can be intervened within the first 48 hours with appropriate antiviral testing and antiviral treatments. The same way with COVID-19. If you can get identified quickly with a respiratory viral panel swab or even other testing that's available over the counter, you can get more appropriate intervention quickly. And that's really the most important key things. With things like strep throat or the common cold, though, sometimes waiting longer actually makes more sense because then it's easier to detect the pathogen, or in the case of a common cold, it's just easier to deal with symptom management and then see a provider kind of in the later stages. So the age-old adage of, you need to wait and give it time. If it's a virus, like it'll take 5 to 7 days to get better, is not truly the same anymore, especially when you've had exposures to diseases like influenza and COVID, where early intervention decreases the likelihood of you having complications because we can get you on antiviral treatment earlier.
Sure, and how do you know if you have flu, a cold, RSV, COVID, how do you differentiate?
So that can be kind of tricky, that can be kind of difficult because for each person it's a little bit different. Influenza, the hallmark of it normally is dealing with like higher fevers, muscle aches, joint aches. Sometimes you can have a cough, sometimes you can't. There's kind of this presentation kind of symptoms that are there. COVID-19, though, is really interesting because it mimics and acts an awful lot like the common cold. You can start with congestion, you can start with runny nose, sore throat, it can then evolve into a cough, it can sometimes not have a cough. Some people have problems with gastrointestinal symptoms like nausea, vomiting with it. And so it's really, really kind of a myriad of things with COVID-19. It makes it hard to identify. Strep throat's pretty easy. You start having problems with strep throat, start having some problems with like soreness, fevers. You can sometimes have some problems with like swelling in the glands of the neck, Normally it doesn't come with a cough or anything like that. And most of the time you have some type of exposure to somebody with strep throat to truly get that. So there are some symptoms, there are some signs, but anymore, if you're a person who's at risk, who might benefit from antiviral treatment or early intervention, it's really recommended that you be seen quicker to get that viral testing to know for sure.
Sure, and let's talk about treatments.
Yeah, the primary treatments right now for influenza, there's two primary ones. The most recent one is one called Xofluza. It's a single dose medication. Because it's a brand new type of medication, it's harder to get a hold of and it can be more costly to obtain. The age-old one is Tamiflu or oseltamivir. It's a twice-daily medication you take for 5 days, but if you've been exposed to somebody with influenza, there's actually a prophylactic treatment that you can take daily for 10 days to help avoid symptoms and complications, which is another huge benefit to getting tested early. Paxlovid is the current medication that we give for antiviral treatment for COVID-19, and starting it within 48 hours has shown to reduce symptom severity as well as the likelihood of progression into a viral pneumonia that could cause hospitalization. So early detection with those are extremely important.
Sure, and if a person has pretty severe symptoms, is there a way, if they can't or they don't want to maybe go in and spread their germs, is there a way they can contact the hospital to get testing or treatment?
Yeah, we used to offer like a drive-up testing that was really easy and convenient, but unfortunately due to changes in regulations, we can't do drive-up testing. However, we do still facilitate, at least at Russell Regional Hospital, if you call ahead to just come in and get a viral swab that's done. Normally you either have to come into the facility or into our lab to have that done, but it is relatively easy where you don't have to go sit in a waiting room where you could expose people to your germs. It's a very convenient way to get that tested. As long as you reach out to us and ask for that, we normally can accommodate.
Sure, good to know. We've heard of RSV being tricky for children, but what about the older people?
Yeah, so RSV is a very interesting disease in that it does cause problems with the respiratory tract, primarily in younger kids, but we've also found recently that it can be a cause of a lot of viral pneumonias that happen in people that are older than 65 that have an immunocompromised state, so people whose immune system aren't nearly as strong as they were when they were younger. It can cause problems with a pneumonia that is very, very tricky to treat because normal treatment with antibiotics just don't seem to work nearly as effectively for them. They typically require hospitalization with supplemental oxygen being provided and with intravenous like corticosteroids and other interventions like breathing treatments to help stabilize and get them better. It's gotten so bad to the point that we actually have developed a vaccination to RSV that's recommended for not just younger individuals but also for the elderly individuals, where we start vaccinating for as soon as 60 years old depending upon the person's underlying health conditions.
Okay, and what is norovirus?
So norovirus is an interesting one because it's primarily causing inflammation within the gastrointestinal tract. The majority of presentations with norovirus either come with like nausea, with vomiting, or with like profuse diarrhea. And the biggest problem with norovirus is it can also cause fevers, but that it can lead to dehydration, which can cause problems with renal problems. It can cause issues with just not feeling well. And so for a lot of folks who end up with norovirus, we have to do some type of rehydration strategy, whether that's orally with like liquids, or whether even intravenous treatment's needed. And sometimes they even need intravenous medications to help settle down the nausea and vomiting that they can have.
Sure, and who is typically at risk?
So norovirus can affect almost anybody, young children all the way up to adults, even elderly people can be affected. Typically, again, it's very similar to RSV in that the majority of people that have complications are those that are at younger ages and those that are immunocompromised or that are in our elderly population.
Sure, and are there any tips for prevention?
Norovirus is spread by like droplet contact, and so the biggest thing that you can do is just like during common cold season, make sure you're keeping good hand hygiene, whether that's hand washing as recommended or using like a hand sanitizer is extremely important. And of course, if you yourself are being ill, make sure you're trying not to handle things that you don't need to be handling, and make sure that you stay up with your hand hygiene as well.
Sure. Now, are there any types of influenza that are in this area, or does it depend on where you're at?
So influenza, there's primarily two ones. A and B are the primary types. Some flu seasons it can be more common and to see like a specific subset, whether it be A or B, but honestly in our worst influenza seasons we typically see both in a mixed infection. This year particularly has been a little bit harder on influenza compared to years previous, at least the last 2 or 3 years, and we've seen, at least at Russell Regional Hospital, a combination of influenza A and B. Though truthfully I think I've seen a little bit more influenza A, especially during the very beginning parts of January. We had a lot of cases of it there.
Sure. Hopefully that settled down for the year. Now, speaking of settling down, COVID has seems like has settled down. Has it, or do people just not know they have it, or what's the status on that?
Yeah, so COVID-19 kind of comes in fluctuations. Like there's times when it's definitely a lot more prevalent. From my own personal experience, it seems to be more cyclic in nature than not. And so it tends to recur about every 4 to 6 months. Our most recent kind of outbreak was in January, kind of beginning of February. We haven't seen nearly as many cases in the last 4 weeks at Russell Regional Hospital, but we still have the occasional person that comes in positive. Normally we see it kind of at the beginning of cold and flu season in October, November, and then we see it right in the heart of it, January, February. And then there's normally a little bit of a summer kind of infection that sometimes happens between May to July, just depending. So there's about 3 times a month where we have a little bit higher prevalence of COVID-19. I think the biggest kind of hindrance is we just don't do as much testing as we did when it was initially kind of discovered, and there was a big kind of push to kind of know what was going on with it. And that's understandable. If you're a regular healthy adult and just having upper respiratory symptoms that are consistent with a cold, it's possible you just have the common cold. It's possible that you have COVID-19, but getting antiviral treatment early probably isn't as necessary for you. So you may not come in and be tested, and that's all right. That's acceptable.
Sure. And at first, if you were tested positive, you had to quarantine for all these days. What's the status on that right now?
Yeah, so since we've gotten the majority of our population vaccinated and continue to vaccinate those that would like to receive vaccinations, the need for quarantine and the need for kind of social distancing is long gone. It's much more appropriate if you're worried or you have risk factors for COVID-19 to maintain vaccination status and to make sure that you are maintaining good precautions, good hand hygiene. Those kind of things are more important than worrying about quarantine and worrying about staying away from folks. Of course, if you're running high fevers, your likelihood of spread is much higher. And so during that time frame, it's best to try to keep your distance from individuals, whether that means calling in from work, whether that's skipping school because you have to do such. That's reasonable. That's still smart. I would advise the exact same thing with almost any upper respiratory infection, influenza, even streptococcal sore throat. I would say the same thing. So it's kind of fallen into the same kind of categories that all those other upper respiratory illnesses have.
Sure. Okay, we're going to shift gears right now. We're going to move to obesity. What is obesity and what are the types?
Yeah, so obesity comes in a broad kind of group of category. Its primary classification, though, is having a BMI that's greater than 30. BMI is a shortened term for body mass index. It's basically a calculation of height and weight that is then averaged, and it's given a score. Normal body mass index for average individuals should be between 20 and 25 as their number. Individuals that are overweight are considered to be between 25 and 30, and then those that have a BMI that's greater than 30 is considered to be obese. There are different classifications of obesity, though, and the classes depend upon what your BMI number is. So class 1 is between 30 and 35, 35 and 40 is class 2, and then it goes 3, and then 4 every 5. And then once you hit class 4, it's kind of anything above that specific number would be consistent with that. Yeah.
Sure. And what are the causes?
Obesity is primarily caused by excessive calorie intake and decreased sedentary lifestyle, though there are some secondary causes that from obesity. There's medications that, because of their taking, can lead towards gaining weight. There's also genetic factors that weigh into this. There's also hormonal factors that weigh into it. And so while, definitely diet and exercise is an extreme kind of leading towards people that get obesity, there are definitely other risk factors that are involved.
Sure. And what are some complications that can result from obesity?
Yeah, so obesity has been linked with several kind of chronic health conditions and several problems. Coronary heart disease, problems with stroke, problems with liver dysfunction, problems with kidney disease, problems with type 2 diabetes, problems with chronic wounds have been associated with obesity. I would be hard-pressed to tell you if there's not at least some type of chronic illness that hasn't shown signs that when a person is obese, it's much harder to manage and much harder to control.
Sure. Right now, the rage kind of is the GLP-1 injections. Are those safe? How does that work? And who would you suggest uses them?
Yeah, so the GLP-1 medications are ones that are like Ozempic or Mounjaro are the two main ones. There's semaglutide and tirzepatide specifically. Those medications work on cell receptors to increase the expression of insulin so that your body can absorb its own insulin naturally. It's very effective in patients who have type 2 diabetes. In fact, they're type 2 diabetes medications. They help with reducing the amount of diabetic medications an individual might use, while also too giving them a lower hemoglobin A1C, which is extremely important in a type 2 diabetic to maintain less than 6.5% or 7.0% depending upon the person. The medications have great side effect profile that help with management of obesity, which is why they've kind of come in vogue recently. They provide kind of an appetite suppression, which is very great to help kind of lower calorie intake. They also cause problems with like gastric kind of side effects, nausea, a little bit of bloating, and some other symptoms that you can have. Those symptoms, while can be uncomfortable, also too help promote appetite suppression, which is really, really important in individuals that are trying to reduce calorie. That's primarily how they work. However, there are some people and some kind of studies that show that insulin resistance is part of the reason why these medicines work so well. As individuals gain more and more weight, their body becomes more resistant to their own insulin, and that makes it so that it's harder for them to lose weight. So individuals who have tried like routine diet and exercise and just can't seem to get that weight off and have good success initially or even very minimal success initially and then kind of struggle and for lack of a better term plateau in their weight loss, they're great candidates for consideration for GLP-1 medications because they can kind of give that extra incentive, that extra motivation to continue with the lifestyle changes that they've gone through to maybe help promote a little bit more weight loss further. Myself as a practitioner, I think GLP-1 medications are exceptionally safe. I think they work exceptionally well for my patients. They do a great job to help kind of those symptoms. There's good medications to help with the side effects. So overall, for the majority of patients, like they're relatively safe. From patients you want to be careful with, individuals that have like thyroid disease or have histories of thyroid cancer or specific family histories of thyroid cancer should avoid these medications. Patients who have rather aggressive type 2 diabetes can be on these medications, but modifications have to be made. Same with people who have chronic kidney disease. You have to really be careful with the dosing on this medication and be extra careful, but they can still benefit from these medications. So overall, if it's a medication that you think might be beneficial for you for obesity management, definitely talking with a provider would be worthwhile.
Sure. Now, are they intended to be short-term or a long-term medication?
So the majority of studies show that they can be used for short-term kind of weight loss and short-term weight loss promotion. The problem is that individuals that use them for weight loss, after stopping them, normally see a rebound effect and start gaining weight back. Normally studies show it's anywhere between about 20 to 40% depending upon that study. So an individual that lost 100 pounds on these medications, which is phenomenal weight loss, would expect to see a 20 to 40 pound weight gain. New studies are showing that the medications are safer to take for a longer period of time. So if you're looking for more sustained weight loss, it would probably be appropriate for you to continue those medications. But that's, of course, in combination with talking with your provider to make sure that it's safe for you specifically. There's also been some additional research going into microdosing of these medications at smaller doses than what are therapeutic. And that's a really big revenue kind of exciting area in medicine that we're starting to explore to see if there's alternative benefits to giving even small doses of this, because insulin resistance probably as a society we have a lot of just due to our diet and our current lifestyle, truthfully. So I think as we learn more and more, we'll be able to get even more indications and probably get people on these medications that would be helpful in the future.
Sure. And are these medications typically covered by insurance?
So that's the hardest part right now is there's a lot of insurances that don't cover these medications, and because they're relatively new, they have a very high price tag, so they're hard to get a hold of. There are some exceptions to that. I mentioned earlier in my discussion that type 2 diabetes is an important medication. It's part of the regimen for treatment. And so for patients who have type 2 diabetes, they can typically get on either semaglutide or tirzepatide or one of the medications like them. So they are normally not too hard to do. One medication, Zepbound, recently came out with an indication for people who have obstructive sleep apnea. And so some insurance providers are now starting to cover that specific medication. Zepbound is tirzepatide, which is a homologue for like Mounjaro. So it's a great medication option for some patients. And as we work more and more with other chronic diseases, we're finding their benefit in regards to obesity management and weight loss. And so I think more and more indications will open up and they'll be available for more and more people. There are some abilities to get medications directly from some of those providers. And so if you do have an interest in paying a reduced price in those medications, you can talk with the provider and The pharmaceutical companies provide them direct, or you can even find compounded forms of that medication that come at a lesser price than the out-of-pocket price for them.
Sure. Excellent. What a great information. We're going to switch gears again. We're going to talk about infectious disease, and are there ways to avoid catching infectious diseases?
Yeah, so infectious diseases can come from a variety of different things. There's bacterial diseases, there are viral diseases, parasitic diseases, all of which have kind of ways to avoid complications with them. Viral diseases are by far the most common. They're very easy to help prevent in regards to just basic kind of maintenance of your own health, good hand hygiene, good kind of distance control with individuals that are sick. So all of those things kind of play into case with those. Bacterial infections are kind of secondary infections, or in people who have immunocompromised state, they can be a little bit more prevalent. So typically we see those happen as kind of secondary effects from either a viral illness or like an injury. For those specifically, like good ways to help prevent, to prevent those is to try to avoid the first thing that caused it. But treatment with like an antimicrobial is very, very easy to do with those when they're identified. Parasitic diseases are a little bit harder, but because of their rarity, they're not as frequent. Their biggest things is trying to avoid what specific thing caused said parasite to kind of come into contact with the individual. So avoiding the consumption of like raw meats is a big one with parasitic diseases. Avoiding individuals that carry that disease, or when they do, to do good instructional care to help avoid further contamination would be important with those individuals.
Sure. Seems like this past year there's been a lot of struggling with coughs. What causes a cough?
Yeah, so a cough is typically caused by like bronchial irritation that occurs in the bronchial tubes of the lung. There's very small finger-like hairs that stick out that are called cilia, and cilia irritation can lead to coughing. That's very, very tough to help treat though, because a lot of the stuff that we use over the counter and a lot of the stuff even as prescriptions that physicians use may or may not be beneficial for coughs. Some individuals swear up and down by medications like benzathionate, which is a like fluid-filled pill that helps reduce cough. Other people think that corticosteroids help with coughs. Some people think that cough syrups containing like promethazine or codeine or other medications help with coughs. But if you actually look at like science and look at like studies looking at how to reduce cough frequency, there's really never been a great medication that's shown that it is superior to any other. So often as a provider, I have to talk with patients and say, what medication works best for you, and try to find a good compromise to get them the medication that will help with their cough and not. You mentioned that there's been like a prolonged kind of episodes of cough for people lately, and our most recent upper respiratory kind of illnesses in this specific flu and cold season have caused much more prolonged coughs than normal. Cough is considered to be subacute or prolonged once it's hit that 2-week mark, but chronic coughs don't really get considered until they hit about 4 weeks. And I'll be truthful, I've seen people who've had coughs all the way up to 6 and 8 weeks in this specific cold season. And it's very, very challenging because of all that irritation that happens within the bronchial tubes. Personally, as a physician, I've used a combination of corticosteroids, antimicrobials, cough suppressants, anything I can to get my patients relief. And even then, sometimes it's not enough. You just have to tell them, the storm will go away. You just have to weather it as best as you can, and eventually it does get better.
Sure. All right, we're going to go to the phone lines. We've got Jennifer on the line from Hayes. Hi, Jennifer. Go ahead and with your question for Dr. Summers tonight.
Yes, I was wondering if there has been any sign of measles concern in our area.
So thank you for your question, Jennifer. I appreciate that. So measles has kind of been on the uprise nationwide, to be truthful with you. We've had some good education as staff at Russell Regional Hospital in regards to measles prevention and measles treatment. As it stands right now, we've not had any active cases in Russell County specifically. In Ellis County, I don't believe there's been any cases either where you're from, Jennifer. But we do know that there have been some in Southwest Kansas and a lot in the Kansas City metropolitan area as well. Measles prevention is by far the best thing that can be done, and so if a child can be immunized for measles with the MMR vaccination, I do recommend that they get that vaccine done, though there have been cases of measles that even occur in people who are vaccinated. So knowing the signs, knowing the symptoms, and how to intervene early is exceptionally important in measles. And so if you see those signs, if you see those concerning findings, it's definitely important to get checked out sooner rather than later by a provider.
Sure, we have just a little bit of time left, but you might explain what the symptoms are.
Yeah. So measles is a disease that starts first with fevers. They're relatively high fevers, to be truthful with you, and then you start noticing a rash that occurs on the individual affected. The rash has a very unique presentation compared to other rashes. So as it begins normally around the top, the crown of the head, and then slowly starts to go down the entire body of the individual. It typically is a much more fine rash than other ones, so instead of being like big and kind of fluctuant, it's more kind of pinpoints that kind of happen. But as the disease progresses, it tends to get worse. Individuals can sometimes have runny nose with it. They can sometimes have sore throat with it, and they can sometimes have like cough as well with it. So it can present like a respiratory illness. The main thing though is the higher fevers and also to the rash that I kind of described. So if you see any signs of that, getting tested early, getting intervention early is really, really important. However, I would tell you the most important thing you can do as a parent is to make sure that you get good fever control with either acetaminophen, ibuprofen, or medications like that that help with fever reduction.
Okay, a lot of great information again tonight. Thank you so much for being our guest. That's Dr. Tyrel Summers from Russell Regional Hospital. On our next Doctors on Call, we'll be discussing IV hydration therapy. You can email questions to us for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.